Good afternoon, everyone, and welcome to our media availability this afternoon. I'm going to kick us off this afternoon and first begin by expressing my deepest condolences to the family and loved ones of Summer Lim. She is the 11-year-old student who tragically lost her life last Thursday after being struck by an MCPS school bus. Like so many residents across the county, my heart aches for the family members and our whole community. I want to recognize the students who acted swiftly to call 911 and the neighbors who rushed to the scene to provide assistance. Our thoughts are with the entire school community as they grapple with this heart-wrenching tragedy. In addition to the grief counseling that MCPS is providing, I do want to encourage people impacted to reach out for assistance by calling 988 or 311. The Montgomery County Police are still investigating this crash and will share more details at the appropriate time. It may take several weeks or longer for a full investigation to be completed by the Collision Reconstruction Unit. We are also thinking of the family of Monique Charles, who was shot multiple times and killed in the 1700 block of Imperial Drive in Wheaton. After a vehicle chase ensued, Montgomery County Police apprehended the suspect, and I want to thank all the first responders who took swift action in this and so many other emergency situations that our residents are involved in. October is Domestic Violence Awareness Month. If you or someone you know is in need of assistance, please reach out to Montgomery County's Abused Persons Program at 240-777-4000 of the Family Justice Center. Now moving into council and county matters. Today, I am pleased to be joined by some of our DHS health insurance folks. We have Sean Gibson here. Thank you for joining us. We also have one of our health navigators, Yajaira, Isabelle, and following Governor Moore's recent visit to the HHS headquarters in downtown Silver Spring, where he heard directly from our health navigators and staff about how they're connecting with residents to essential services, we thought it was really important to have you all here this afternoon to talk about the work you're doing. The federal shutdown is affecting every aspect of our daily life across the county and across the state. And as we have for the past 10 months, we remain united in our commitment to help residents and families impacted by the actions of the Trump administration. I'm going to turn to my colleagues in a moment, but I want to give a couple of quick updates from the council. This morning, we held our council meeting and had two proclamations. One was a proclamation recognizing International Pronouns Day, which I led with Councilmember Glass and Mink. We've been doing that proclamation for the last 3 years. The reason that we do it is because using pronouns that individuals determine for themselves is fundamental to human dignity. The goal of International Pronouns Day is to help all people learn about the importance of using personal pronouns and to make the use of personal pronouns commonplace in our everyday lives. Using someone's chosen pronouns is a simple way to show respect and acknowledge their identity. Misgendering disproportionately affects transgender and gender non-conforming people, so we take this day to encourage awareness and promote the sharing of individual pronouns, such as including pronouns in emails and introductions. Montgomery County is committed to being inclusive and welcoming and supporting human dignity and celebrating diverse identities, even as some of these policies threaten all of those things at the national level. And so we did that this morning. The other, I'm wearing bright pink today because the other proclamation we had was recognizing Breast Cancer Awareness Month. Breast cancer is the most common cancer among women in the United States, and about 1 in 8 women are diagnosed with breast cancer in their lifetime. It is projected that approximately 316,950 women and 2,800 men will face the challenge of invasive breast cancer. Tragically, it is anticipated that over 42,000 women and 500 men will lose their lives to this disease. Black and Hispanic women often receive breast cancer diagnoses at later stages and face significant challenges in accessing care that meets established guidelines for the most effective treatment. Disparities are particularly significant for Black women who, despite having a lower incidence rate of breast cancer compared to white women, experience a 38% higher mortality rate. This month is about raising awareness and encouraging everyone to take breast cancer seriously and develop more and share resources for care. Early detection saves lives, and early screening and timely follow-up to care is essential. And together with our partners who are here with us this morning, we want to raise awareness about early detection in our community. Moving on now to the work sessions we held this morning, the council also received a briefing on the changes to the federal food assistance and nutrition programs and the federal grant-making landscape and the impact on Montgomery County services and residents following the passage of Trump administration's One Big Beautiful Bill, or H.R. 1. On food assistance, we know that SNAP provides monthly benefits to help individuals and families buy food with eligibility based on household size, income, and limited resources. H.R. 1 will cut federal SNAP funding by $279 billion through 2034. In Maryland, over 680,000 people, including nearly 270,000 children, receive SNAP benefits each month. About 369,000 Maryland families could lose some or all benefits, with families losing an average of $81 to $150 per month. In Montgomery County, roughly 68,800 people, including nearly 30,000 children, rely on SNAP each month, and these cuts would directly affect them. These cuts are being shifted directly to the state. In addition, we know that SNAP Ed provided free nutrition education to low-income families and SNAP participants in Maryland, helping students and households make healthy choices, stretch food dollars, and prepare nutritious food meals. H.R. 1 eliminated all funding for SNAP Ed as of September 30th, 2025. This ended a program that was 100% federally funded and operated by the University of Maryland Extension. The program reached 424,000 Marylanders, employed 70 staff statewide, and provided services like school nutrition education, tastings, and gardening programs. In Montgomery County, SNAP Ed's 2025 budget was $620,000, supporting 4 full-time education and 2 part-time assistants, partnering with 37 schools, Judy Centers, Head Start classrooms, and 9 community sites. Ending SNAP Ed shifts the cost to the state, with Maryland protecting an additional $412 million in FY27, potentially forcing cuts to SNAP benefits over critical services or raising taxes. And so we can see right here, we're already seeing the impact of those cuts through H.R. 1. We also talked to the Office of Grants Management about what they are seeing and what the impact of H.R. 1 and executive orders will have. There are definitely impacts that we are seeing on reshaping how grants are awarded. We are reviewed and terminated. The Trump administration introduced new oversight of the federal grant-making landscape, ultimately resulting in heightened uncertainty for the nonprofit community. For context, in fiscal year 2024, the federal government awarded $46.2 billion in contracts and $31 billion in grants within Maryland. As such, the changes outlined in the August 7th executive order titled Improving Oversight of Federal Grant-Making, the Trump administration's directive to transform how federal agencies admitted grants in alignment with national priorities. These changes are expected to have significant impact on nonprofits and community organizations, both here in Maryland and in Montgomery County. The impact from the federal government on local nonprofits and the community are severe. Data from the Department of Government Efficiency shows at least 473 terminated or frozen contracts and grants to nonprofits and businesses in Montgomery County. 473. And we rely on these nonprofits and businesses in our county to deliver vital services. Grant reimbursements have also been delayed. Losing this major federal funding is expected to strain community organizations. further in the coming months, making it harder to meet demand, maintain staff, and provide essential services. I encourage everyone, that's just a highlight of what we learned from our Office of Grants Management and our Office of Food Systems Resilience. I encourage everyone to take a look at the council session earlier today, and we will have more of these for our full council discussions in the coming months. But now I do want to turn it to our guests and our folks who collaborate, who are on the front lines. I don't know, Sean, are you going to start first? Or?
I will start.
All right, I will turn it over to you.
Well, thank you, number one, for having us here today. It is definitely a pleasure to have the opportunity to talk about the wonderful work that the Navigator staff are doing. My name is Sean Gibson. I am the Health Insurance Manager for the Office of Eligibility and Support Services within DHS. It is my pleasure to have wonderful. What I'm really excited about is that open enrollment is coming. That's our Super Bowl. That's our time to give people the opportunity for health insurance. And so that starts on November 1st, goes through January the 15th. All our staff are here and present to make sure that we're able to provide the services that the residents need. But I don't want to do all the talking because I have an absolutely amazing staff member here who, Shirley, I turn it over to Yaya.
Again, like we say, thank you so much for giving us space and to provide you information. As my name is Yajaira Isabelle, I am a health insurance navigator. I have been assisting Marylanders and Montgomery County residents for about 4 years, providing them enrollment services and providing them education about health insurance through our Maryland Health Benefit Exchange. So I am beyond thrilled to be here, sharing space with you, and we're excited.
Great. Do you mind if I call you?
Yes,
okay,
please.
because I remember that from the
Yes.
meeting with the governor. I think you shared a story that day about a family that you assisted.
Yes.
And I don't know if you want to if you can share that story about the reach that you have into our community, ensuring people get coverage.
Like I was sharing with the ladies earlier when I arrived here, I do carry some stories to my heart that impact my work when I work as a health insurance navigator. And I would have to say this particular family, it's a family of 6, 2 parents, and the remaining were children. And it started off as an outreach at a local Title I school in Montgomery County. It was a back to school. And she approached my table and she said, "What is Maryland Health Connections?" And I said, "Well, Maryland Health Connections is a state marketplace where Marylanders can apply for health insurance." And it's, the simple question, right? Do you need health insurance? And she opened up and she said, "Yes, I just arrived to Maryland, but I have not obtained health insurance for my children because sometimes when I go to the Department of Health and Human Service, it could be a scary place, right? You automatically feel like you're going to get a denial." And, I could sense that concern for her. And I said, "Well, you don't have to go in person." At that time, we were doing virtual calls. And so I said, "We could schedule you an appointment." And I scheduled her an appointment. I spoke with her the following day and I did an application. But as I was finishing the application, I noticed that, they were not applying for health insurance, which is the father and the mother. And, I asked, "Okay, we're applying for your children, but are we applying for you as well?" And she said, no, just the children, because we don't need health insurance. I don't think we're eligible for it. And I said, "I think you are eligible for it. I do the screening and it seems that you can apply for healthcare coverage." And she was, I have been here in the country for quite some time and I've never obtained healthcare coverage. And so I said, "Well, today we're going to apply for you and see if you're eligible for it. And if you like the plans and you like the prices, then you could enroll even if you don't, that's perfectly fine. We could provide you other resources that Montgomery County offers." Of course, I finished the application and sure enough, they were eligible for healthcare coverage. And she was beyond grateful. Her focus was her children, right? And my focus is to make sure that when I finish with somebody, everybody's enrolled, or at least try to have them enrolled. These children need healthy parents, right? And how do you get healthy parents? It's by doing your preventative checkups. And how do you get preventative services? Through healthcare coverage, right? And so she was beyond thrilled. The funny thing is that I actually speak with her every year, randomly throughout the year, and I see her progressing. And as her years change, I see different type of services. And but that was one story that holds dear to my heart, because we left out thinking that she was just going to get her children insured, and her husband and herself got insured.
Terrific. Well, I think as we've been discussing, there are a lot of ways and many resources in the county for residents. And the most important thing is we want folks to know about the resources that are available, and amazing navigators like Yajaira who can help go through the whole process with them. So I think we can, Jordan, I'll turn it back to you to open it up for questions.
Great. Thank you so much, Council President. Reporters, if you have any questions, raise your hand and state your name and organization. Fitzgerald with Fox 5.
Okay.
Good to see you. I have questions for all of you, actually.
All right.
Council President, if I could just start with you.
Yes.
Obviously, we're in day 14 of this government shutdown right
Yes.
now. There is a large number of federal employees that live here in Montgomery County. What kind of strains is that putting on county resources right now to help these federal workers who live in Montgomery County?
Yeah, thank you, Tom, for that question. So right now, we're making sure that people have information. As we discussed this morning, some of our federal workers have missed one paycheck, and we're making sure that they're connected to food services if they need it. One of the things that we discussed this morning was the fact that if someone is being affected by the shutdown, that their family can apply for the farms program, the food program through the schools. So we're right now trying to get information out about the resources that are available to folks, and we're working closely with our Department of Health and Human Services, with our nonprofits.
Are you getting anecdotal reports from county agencies right now that they are getting a bigger request for service right now?
Not an overwhelming request for services right now. Again, I think we're just at the start. People have obviously missed one paycheck, and so we want to make sure right now where we are is getting the information out, because if this goes to a second paycheck that people may miss, there's going to be more strain on their family resources.
If I could continue to follow, if you don't mind, we're expecting, and we're hearing this from congressional leaders
Yes.
right now, that this is going to go longer.
Yes.
The last one was 35 days. Could this be a wave that you're going to face in the coming weeks if this continues?
Well,
Are you preparing yourself?
absolutely. I mean, and we've been working for the last 10 months. This federal administration has been decimating our community through federal RIFs, layoffs, and other things. So yes, the shutdown impacts a larger percentage of our families, but the truth be told, the Trump administration has already been doing a great deal of damage, whether or not it's through actually laying people off or just the trauma people are experiencing in our community. So in Montgomery County, because of the foundation we have, our amazing staff and nonprofit system. The other thing we discussed this morning was during last year's budget, we budgeted very well to make sure that we had healthy reserves to weather the storm we knew was coming. And so it's going to be tough. But right now, what I want our residents to know is that we are here for them. We have our partnership with our nonprofits, with our government agencies, and we're prepared to weather the storm.
I'll be quiet after this.
Yeah.
If I could just ask your colleagues, the heart of this dispute right now seems to be on the expiration of the Obamacare tax credits. We are getting warnings from the Democrats that if these tax credits are not extended, you could have a massive increase in people's bills. Are you getting those kinds of questions right now? And you're talking about a family who's scared off just by the process right now. Some of the cost estimates we're hearing are eye-popping. Has that been raised, and are people going to be in a position to afford this if the tax credits are not extended?
So from our level, and I tell you, I know that Maryland right now is working on a subsidy program that is going to allow individuals to get health insurance, and I think that's wonderful, something that the governor is doing. In addition, we're here for Medicaid. So if someone needs, Medicaid is year round, want to make sure that we're clear on that as well. And so when someone needs health insurance coverage, we are here to assist them from the Office of Eligibility and Support Services. And if the tax credits get extended, we're here to continue to help with those enrollments as well.
That's great, but if they don't, I mean, is that a scary situation for people who are?
Me, as a health insurance navigator, we are equipped and we have resources from the Maryland Health Benefit Exchange that they provide us daily. Our live estimator is live on Maryland Health Connections, where individuals can go on there, check out the price in live to see if that price is going to be affordable for them for 2026. We are available in person, virtual. We are available at 3 locations. We are through Silver Spring, through Rockville, and Germantown. They are welcome to come. We are available Monday through Friday from 8 a.m. to 4 p.m. All of our health insurance navigators are trained to answer any questions, any concerns that they may have. We could provide them assistance with the estimator on site, assist them with the plan selections. We also have brokers throughout the county. So I don't, even though we do hear tax credits are going away, our governor is working alongside Marylanders to help reduce that cost, right? A little bit of that portion.
And let me add, in Montgomery County, we also have other programs. So we have Montgomery Cares, which is a series of clinics here that we refer to people who do not qualify. And so I want to make sure Montgomery Cares is one. We have Care for Kids. That is a program for youth who do not have health insurance coverage. As the manager, we continue to look at whatever the needs are and make sure that we're staffed up to be able to assist anyone who needs our help.
I would just add also that there's a short term and long term. And right here in Montgomery County, in the short term, we are doing everything we possibly can to make sure people have care and continuity in care, and that's not disrupted. Now, long term, there's going to be a fiscal impact to us and to the state. But what we're doing right now is front and center, centering people and their care, and then making the plans for how or when and if these cuts come, how are we going to be able to partner with our folks at the state to actually continue this into the future. So I think for right now, what we want people to do is make sure they're contacting us so they have that continuity of care, and let them know that we are working around the clock with our state partners and the Miller administration to figure out how we weather the storm long term.
Thank you.
Thank you, Tom. And reporters, just a friendly reminder, we have a hard stop at 1:30. That's when the council resumes. Any other questions from reporters? Jenny Bixby with the matter.
Hi, thank you, Council President Stewart, and thank you so much for bringing your colleagues. This is very helpful information for our readers. I did want to ask, I think, Council President Stewart, you're probably the most suited to answer this question, but I know that Earl Stoddard mentioned today during that briefing that while there will be, that the council should expect to see some requests for supplemental appropriations, he doesn't think that the county is going to be able to fill in all these gaps that are going to be made. What is your view on that? What do you think those increasing hard decisions are going to look like?
Chris, I think the presentations this morning, what they underscored is that this is still a situation that is very volatile and ever changing. One of the things about the government shutdown right now is that they are not doing the what are called NOFOs and looking at applications. And so them the federal government being able to further restrict sort of the grants into the future, that's sort of on hold right now because they're not putting those out on the street yet. And so I think we are still in the process of evaluating what the financial impact is going to be on us, as we heard Director Murphy talk about. We know the impact as the number of the 473 that I mentioned of nonprofits and businesses that have already faced the cuts. And we're working with our partners at Nonprofit Montgomery to figure out what impact that has had on them. Just as we answered the question on the health insurance tax credits, what this Trump administration is doing is, and what their goal and what they've stated their goal is to do, is to completely upend all our institutions and foundations in this, in our government. They are also specifically targeting certain groups of people. We are going to do all we can to continue to support our community and individuals, and we are going to have to prioritize some things. We don't yet know what all these cuts are going to be, but we do know it is going to be tough and nearly impossible for us to completely backfill the federal support that we are now getting.
Thank you.
Great, thank you, Jenny. And Council President, we do have a question from the Washington Post. You can look at Jim Thompson and answer
okay.
this. Nicole Asbury with the Washington Post is saying Maryland K-12 schools are asking for a comment about the MCPS CIP plan and Dr. Taylor's recent announcement regarding the capital budget.
Great, thank you for the question regarding the MCPS capital improvement budgets plan. So the superintendent just released that last night. I believe the school board is reviewing it today. The process it will go through is the school board needs to review the superintendent's proposal. They will vote on that. It will then go to the county executive and then come to the council as we move through our process of reviewing the capital improvements projects. So we just received it the same time members of the public did last night. We understand the great needs that there are in our facilities for our schools, and that this is not just in Montgomery County. The comptroller released a report for the state of Maryland that looked at actually how far behind we are in keeping up our school facilities. And so we will have discussions on priorities and what we can fund in the near term as well as the long term.
Great, thank you. Any other questions from reporters going once, twice, 3 times? Okay, back to you, Council President.
All right. Well, thank you everyone for joining today. Thank you to Yajaira. Thank you to Sean for joining us today. And we look forward to seeing you again next week. Thank you, everyone.
Thank you.